Hello. If you haven't already watched my introduction video, please go watch that so you can know a little bit about who I am. My name is Nadia. I am a veterinary technician of 5 years. 2021 is my 5th year being into the field. So in this video, I'm going to be talking about what a veterinary technician is, what we do, our duties, and then I'm going to go straight into talking about vitals for your animals. So I just want to put a disclaimer up there that I am not licensed or certified in veterinary technician because I am going to school to be a veterinarian. So I'm skipping doing the vet tech world because I want to be a doctor. Okay, but I have 5 years of experience. I've worked at emergency rooms and general practice and specialty. I've done all of those. I work mostly with smaller animals, dogs and cats and furry things. I'm not a doctor. I cannot prescribe or diagnose. So if you ask me questions, I'm not allowed to diagnose. I'm not really allowed to tell you what's going on with your animal because I could be wrong and I don't want to give you any false information. So everything that I'm telling you here is based off of my knowledge, based off something that I am 100% positive about, something that I practice often. So just a disclaimer here that I'm not a doctor, and take my advice as you will, but definitely the most important thing is to talk to your veterinarian. Okay, to slide right into it. So a veterinary technician. So there is a couple levels of the veterinary field. Same thing as human field. So there is your receptionist. I don't need to explain that, right? You have your veterinary assistants, your veterinary technicians, you have your certified and licensed technicians, and then you have your doctors, and that's kind of the level. It's like a pyramid. For me personally, to long story short, in 2016 I applied at a emergency room for animals as a receptionist, and they offered me a receptionist and an assistant position. So I started assisting the technicians and the doctors back in 2016, and then I worked my way up to technician throughout my experience. Basically, technically speaking, to be a veterinary technician, you should be licensed or certified. It's a 2 to 4 year program. You can do it through your college or do it through Penn Foster is one of the options if you do want to be certified and licensed. And I'm not going down that path because I'm going to doctor route. So I want to be a veterinarian. I don't want to be a technician my entire life. I want to be a veterinarian. I want to be a doctor. I want to be a surgeon. So that's not my path that I'm doing. Assistants can do basically anything that a technician can, and vice versa. The difference is that the level of ranking. So usually assistants are more categorized into more literally assisting. So you're doing more things like stocking and cleaning and helping the technicians do the things that they need to do for the doctors. While a veterinary technician is more of the nurse of the veterinary field for the doctors. So they do the blood pulling, they do the catheters, they set up surgery, they assist in surgery, they take the vitals, they do pretty much anything that you can think of a human nurse that does is what we do, but for animals.
We don't play with puppies and kitties all day.
I want to talk about vitals first because I asked on Instagram. Once again, I asked on Instagram questions that people wanted to know, and these are just the most common questions that I get. So for vitals wise, we're talking about dogs and cats because I work with small animals, and I don't know vitals of a horse, to be honest. And so we're going to talk about dogs and cats because that's what I know. So for dogs and cats today, we're going to talk about heart rate, respiratory rate, temperature, and mucous membrane. Those are the common things that we as technicians check for and take notes of to let the doctor know, and then the doctor usually double checks all that, so don't get it wrong. For a heart rate for a dog, it can range because obviously there's big dogs and small dogs, and something that people don't know is that bigger dogs actually have a lower heart rate than smaller dogs. Think of the difference between a Great Dane and a Chihuahua. Chihuahuas are very, so their heart rate's going to be a little higher. So there's a range. The range for a dog can go anywhere between 60 beats per minute to 140, sometimes 200 beats per minute, which is a huge range, like I said. So it depends on the dog size. You have to keep in mind the dog size, the dog breed, the surroundings of your animal, and if it's just an anxious dog. So to take a heart rate for a dog, there's a few ways to do it. If it's a small little dog like a Chihuahua or something that has a smaller chest, you can just go right under the chest and just kind of feel it, kind of cup it right into here and feel the heart rate, and you can you know, counts it that way. Another way that some people don't know is that you can check the inner thigh of the back legs. I'm going to insert a picture of here about how you do that. And obviously if you have a stethoscope, that's the easiest way to do it. To calculate the heart rate, you want to count the beats, and you can do it 10 seconds or 15 seconds or 5 seconds, depending on how you want to do it and what's easiest for you. I personally count to 10 seconds while I'm checking the beats, and then I times that by 6. And that's where we get it. If you do 15 seconds, then you're going to count that and times it by 4. So the range for a dog for respiratory rate is somewhere between a 10 and a 40. A 10 is very low. A 10 could be a dying dog, and a 40 could be a very stressed out dog. So those are the range. The number that I like to see is anywhere between like a 25 to a 30. That's a good range for me. That's a happy number for me. I like that number. That's a good number. If the dog is anxious, or you know, doesn't like the veterinarian, or is something going on outside, there's fireworks, the respiratory rate and the heart rate is going to shoot right up. And it's not always meaning that they're going to die or that they are dying, but also just keep that in mind, that if, you know, there's extreme numbers, to take note of that. The normal temperature range for a dog is 99.9 to 102. 102, 102.5 is scary numbers. That's reaching a fever. That's reaching a dog that has a high body temperature, and that's something you want to keep note of. If your dog is running outside, comes inside, is hot into your apartment, and his temperature is high, that makes sense. The way you get a temperature for dogs, there's a few ways to do it. The normal way to get a temperature on a dog is to stick a thermometer up its butt. That is the norm. That's the way that we do it in the veterinary field. So take a regular human thermometer and lube it up and stick it in their butthole, and that's how you do it. If you want to do that at home, because obviously you need it, it's a 2-person or 3-person job to do that, to keep the dog still to do that. You can put it under their armpit also. It might not be as accurate, so keep in mind you're gonna have to keep it there for a long time and keep your dog kind of still and really get it up in there to make sure it gets a good reading. But that's also another way to do it if you're at home. Last thing, this goes for cats and dogs, so I'll talk about this with cats also, but the mucous membranes. So basically what you want to do, if your dog is lethargic, which means that it's laying down, it has no energy, one of the ways that you can check if he's okay is by lifting up his mouth right here, checking his gums and clicking the gums. Put your finger in his gums and count how many seconds. So when you press the gums, it's going to turn white. Okay? And then when you let go, it'll come back to pink. So if that reaction is longer than 2 to 3 seconds, that might be that there's a problem. Your dog could be dehydrated, or there could be something else going on. You should probably take your dog to the veterinarian. If it's less than 2 seconds, that's most likely a normal reaction, and the gums should be pink, pretty and pink. Okay? The gums should never be white. They should never be very red. Both of those mean that there's something going on with your animal, and you should probably bring your dog to a veterinarian. Okay, now we'll talk about cats. And I have a helper with me today, so I'm going to insert some clips of me doing what you can do for your own cat. Cats also have a range for heart rate and respiratory rate as well. You're going to have to learn your own cat as well. As I said with dogs, you're going to have to learn your animals and get to know them, and it'll be a learning process for you and your animal. Normal heart rate for a cat can anywhere between 100 and 240, which is a lot higher than a dog, so keep that in mind if you have cats and dogs. 240 heart rate for a cat means a very anxious cat. The cat is probably freaking the bleep out, so honestly, so you need to calm your cat down however you can. 100 could mean the cat is very just chill, or there's something going on with your cat, so keep mind of that. For a cat, respiratory rate is the same thing as a dog, 10 to 40. 10 is very low and a 40 is higher. 30 is my magic number. Between 25 and 30 is just, that's a happy number for me. Temperature for a cat is relatively the same thing as well as a dog, 99 to 102.5. Cats tend to have a higher temperature than dogs also. If a cat is having a 98 temperature, that could mean that there's something wrong with your cat. Using the armpit technique for cats, I don't know if it works as well because cats are not as willing as dogs are to just stand there and let you do that, but if they are, you can try it and see how it works. The best method to getting a temperature, whether it's a dog, cat, or horse, is to lube it up and put it inside of their rectum. So for checking a cat's heart rate, because their body is a little bit different than dogs, it's very hard to feel the inner leg part, which is, I'll insert the picture again here of the dog leg. It's very hard to do that on a cat. So the best way to do it on a cat is, besides the stethoscope, is you can feel the chest a lot better. So for dogs, it's harder to feel the chest because usually they have big ribs and a deep chest. You can't really feel it. With cats, you can feel it more. So kind of cup your hand underneath your cat here, and you're gonna feel it on one of the sides basically, and you'll feel it, and then you can count. And also same thing with your cat. I'm going to show you in a second what I mean by mucous membranes and heart rate and everything like that on a cat. I just have to get my cat and hopefully he doesn't hate me. Okay, so this is my baby. This is Jude. He's not happy. To check the heart rate of your cat, you can cup your hand and put it right under his chest here and you'll be able to feel the heart rate most likely. If he's a fat boy, like mine, it might be a little harder, but just kind of try to get up in there. But I want to show you guys how to check his mucous membranes and how you can do it at home. Hey baby, please don't be mad at me. Okay, so what you want to do is you want to lift their cheeks up here. See, they're pink? That's what we like. I know, baby. I know. You're doing so good. Look, lift it up. You want to click it and see how long the reaction lasts. If it's more than 2 seconds, that's not good. So that's pretty much it, guys. I just wanted to get to basics down there. I'm going to definitely be making more videos about Veterinary World. And please comment below more questions and more things you want me to talk about. Someone wanted me to do one about spay and neuters, which I will do. That'll be in another video because that's a big topic. I'm gonna make a different video about that, so that will be coming soon. Thank you guys so much for watching. I hope that you enjoy. This is gonna be a whole series. I'll make a veterinary series. Please comment below or DM me on my social medias what other questions you have about the veterinary world or about your animals. Thank you so much.